How does trauma impact hormones? Well, I would love to tell you. Today we're talking about how trauma and nervous system dysregulation affect your hormones and how to approach healing from a trauma-informed naturopathic perspective. Hey there, I'm Dr. Rose Hollow, board-certified naturopathic doctor specializing in women's health and hormones. So if you have tried every supplement and you still feel burned out or anxious or hormonally off, this might be the missing piece for you. And I want you to pay really close attention because trauma and nervous system definitely affect your hormones. So when I was working in a holistic mental health practice, I saw this all the time. It showed up in gut health. It would cause estrogen dominance. Women would have PMS, fatigue, even fibroids that have a history of trauma, and it's definitely connected. Also, I want to say, when you are working with me and my health coach, Amy, we're a safe, compassionate space. So if you decide to work with us, we are trauma informed, we are sensitive to this topic, and you'll always be safe with us to talk about what has happened in your life if you need to process something. But I have to say, we are not mental health specialists or therapists in any way. We are natural health practitioners. So when we're talking about trauma, it's not just big T events, but also chronic stress. You could have had emotional neglect in childhood or in an adult relationship, or some instability in life. And if you're anything like me, you've probably experienced at least one of these, if not all of them. You can go into fight, flight, or freeze responses, and this can be tied to your survival biology. Your body is doing what it's supposed to do. It learns to prioritize survival, but it's prioritizing survival over reproduction, over fertility, over hormone balance. So yes, high cortisol is something that happens. It needs a lot of progesterone. If you're not ovulating, then that is dysregulated. Cortisol causes leaky gut. We know the gut needs to function to be able to detoxify estrogen properly. Then we have thyroid suppression from chronic stress and not feeling safe in your mental or physical space. This all can cause blood sugar instability from adrenaline and cortisol surges, or just losing your appetite because you're not feeling good. You can have PMS, PCOS, fibroids, feel burned out. This just causes the cycle to continue. So what does trauma-informed care mean? It's just not about what we do, but more about how we do it. So we have to help ourselves to feel safe in our physical environment, emotionally, energetically. It may take more than one practitioner to help you do this, but we can be part of that team if you choose to work with us. We choose to practice compassion over compliance. It's progress, not perfection with us. And slowness is strength. You cannot rush healing these things. It does take some time. We don't believe in these like aggressive protocols and aggressive detox strategies. We really want to help our clients create safety in their minds and bodies as they move through their care plan. So, of course, we go slow and steady. We try to meet people where they are. We encourage vagus nerve stimulation, breath work, humming, gargling. We nourish our blood sugar balance. We talk about what we're doing during our daily lives, how we can calm the nervous system down on a daily basis, multiple times a day even, is really necessary and helpful for a lot of people, in addition to, taking the supplements and using the bioidentical progesterone and things like that. So that's how we do it. We do offer functional testing like the Dutch test, like GI map, which can really help fill in the gaps of missing pieces of information where we can hone in on particular things that are going on with a specific person, as everybody is different. You know that. So those types of things can be really helpful, but overall, we just really encourage all of our clients to be working on their nervous system regulation every day, because often this is the missing piece. This is the stumbling block. This is why people are not really getting the results that they need. And again, it takes a lot of consistency, a lot of time. If this resonated with you, please like this video, share it with a friend. Please subscribe to my channel. Let me know in the comments what you have been doing to support your nervous system and if it's working or not. I would love to hear what you guys are doing out there, what's working for you, how you think that any kind of trauma or just living a stressful life has impacted your hormones. I would love to hear what's going on with all of you. I do have a DIY ebook, so I know a lot of people who watch my videos are really strong, empowered women, and you are doing a lot of the healing work yourself. So if you are interested in getting my ebook, it has a lot of my protocols in it for holistic healing, and that's a great place to start. But if you are feeling really stuck and you want to work with someone, because having a one-on-one or one-on-two with Amy and I relationship to help you move through a dedicated process and have accountability with your plan of care and the efforts you're making, with that moral support and encouragement, I really encourage you to sign up to work with us in our practice. We can provide everything that you need, from the testing to the plan of care to one-on-one appointments to lifestyle to teaching different kinds of nervous system support. Our health coach Amy is really, really good at that. And yeah, we have all kinds of support available for you. So please check the description for links to what we have available right now. And yeah, again, if you are feeling stuck, if you've been stuck and you don't know why the supplements and the exercise and the dietary changes just aren't working, please explore your nervous system. Please look into possible trauma in the past. And in addition to working with us, it's always good to have a mental health therapist on your team who you trust, that is qualified to diagnose and treat mental health issues, and make sure that they have had some trauma training so that they are a trauma-informed therapist for you as well. All right, take care.